Hello again everyone, Dr. Dan Bockmann here, and today we're going to talk about why I do not care about leg length inequalities. And I know, all chiropractors are supposed to care about that, right? Well, let me tell you two important reasons why I just kind of ignore them. So, number one, they usually don't matter. Now, what I mean is, yes, let's say you have a patient who's got a femur, that one femur is a centimeter shorter than the other femur, or tibia is a centimeter longer. Well, small like millimeters, or even up to a centimeter, or even sometimes more than a centimeter, depending on the height of the patient, is kind of inconsequential. What real effect is that going to have on them and their back pain or their hip pain? And I confirm this by the fact that by ignoring leg length inequalities, we fix them anyway. We get them back to full function and out of pain without even considering leg length stuff. Now, the second thing is that the reason I don't care about them is because they're usually, often, not a leg problem at all. So they may have an apparent leg length inequality where one looks shorter than the other, and you can do all these tests, right? But in fact, the problem's happening in their hip. Maybe their pelvis is a little twisted and it draws one leg a little closer than the other, and it looks like a short leg, when in fact, the bones in their thigh and their leg may be the same length or close enough. So if we put a heel lift under their apparently short side, then that's perpetuating the problem that's going on in their hip rather than addressing it and fixing that as being the cause. So yes, twists in the hip or leg length inequality can cause problems, but it's almost always if it's a big deficit. So I've actually had two patients who have had leg lengthening procedures done. It's a surgery, yes, it can be done. It's a surgery that physically lengthens the long bones, and it's usually the tibia that they do it on. But in both cases, my patients had chronic, long-standing low back pain that was not responding to functional rehab like I would expect or want them to. They opted for these procedures, and one of them had a 1-inch difference, and she was a 5-foot tall girl. The other had an 1.5 inches, and he was a 6-foot guy. So 1.5 inches difference, and by the way, you don't eyeball those. That's not how you tell. You do it by x-ray mensuration. So basically they x-ray the long bones individually with like a yardstick in the picture so you can actually measure them side to side. Again, this is quite rare to have a deficit that big, and of course, you make a deficit big enough, it's going to start having consequences. So they did that, and guess what? It's not just one surgery. They saw the tibia in half, and they take the two bones apart and they stick a metal rod in there and they slide it back over. Then they install a halo that is drilled into the bone around, above and below the fracture site. And there are spreader bars between the two halos. And every day, the patient has to spread the fracture site 1 millimeter further apart for however many days it takes. So if you had a 1-inch difference, that might be a month and a half, somewhere in there, that you're spreading that fracture site further and further apart every day. The idea is that the bone will fill in the gap. And then the problem is the bone doesn't always fill in the gap, and that's what the problem we had with my female patient. She had non-union, so then she ended up having to go through another procedure. She ended up having 5 surgeries on her leg, and she's got some nice scars around that spot. Now her back doesn't hurt as much, but that's an example of an extreme case. Yes, I'm glad that procedure exists, but in everyday practice, I'd much rather, if they got a pelvic tilt or a twist in their pelvis, guess what? The pelvic bones don't choose where they sit. Muscles choose where those bones sit. So let's look for the tight muscles around the hip and pelvis that may be twisting the pelvis, causing an apparent leg length inequality. And guess what? If their apparent leg length inequality goes away, and more importantly, their function comes back and their pain goes away, well then I don't care how long their legs are. If they feel good and function well, leg length is a non-issue, and I'm certainly not going to put a heel lift under one side because I'm just perpetuating that problem that may be elsewhere. So I hope that's interesting or informative. If so, great. Stay tuned for more rehab videos like this one, and if you have a question you'd like me to answer, leave that as a comment in the section below. And until next time, I will see y'all.